Hi everyone, my name is Austin Piper, and this is our health promotion presentation. My era was 1980 to 1983. A big thing happened in 1980. Jimmy Carter signed an important law into effect, which was the Comprehensive Environmental Response, Compensation, and Liability Act, which actuates the prolonged issues of hazardous and poor understanding of how dangerous waste affects others' well-being and the overall health of our communities, which wasn't a big factor back then. Not many real people worried about that kind of stuff. But as time progressed, we started being more concerned, and nowadays you can tell how much things drastically changed. Also in 1980, the Department of Health, Education, and Welfare renamed the Department of Health and Human Services, which was a big thing. The department's primary purpose was to protect others' health and well-being by providing essential human services. The following statements mentioned above convey how vital things were during 1980 to 1983. Not only was medicine finally progressing, we started seeing how things were affecting our own environment in general. Also during 1981, Dr. Michael made a very good report on four previously healthy young men who had developed a disease. They hypothesized that this was a new syndrome of acquired immunodeficiencies caused by sexually transmitted infections agents. Not only does this emphasize how medical diagnosis can be present in one distinct area, but it can also produce automatic issues that will spread throughout the body, which happens a lot nowadays too. During 1982, states were starting to allow Medicaid to expand for children with disabilities, which played a big factor for families not having a way to actually help their children. And with that, it really helped pay for the medical bills and found treatments that would be more available for them outside of like the hospital setting. Medicaid was starting to be more relevant for families and being used in hospitals in general.
Okay, so my years were 1984 to 1987. So in 1984, the Interagency Committee on Smoking and Health was established. This is also referred to as the Comprehensive Smoking Education Act. So the purpose of this were to inform consumers about the detrimental effects of smoking and to disseminate or widely distribute newly discovered data and research. Another purpose was to try to change the cigarette labels just so consumers were even further informed about the effects of nicotine and all the chemicals and properties inside of cigarettes. In 1985, the first test for HIV was established by the CDC. So this tested a patient's blood for HIV antibodies, meaning the patient had to have already been infected. It was the first of its kind, so it wasn't very accurate, and it also generated a lot of false positive tests. After that, the first international conference on AIDS was sponsored by the CDC, the NIH, the FDA, and more. It was held in Atlanta, Georgia. And basically, it was just to come together and just discuss the immunology, the treatment, the prevention, and the control of AIDS across the country. In 1986, the CDC established the Division of Injury Epidemiology and Control. So this addressed urgent threats such as suicide, prevented violence in elders, and sexual abuse, protected the youth from child neglect and child abuse, and prevented injuries such as concussions. In September of 1986, the CDC sponsored the first national conference on chronic disease prevention and control. So the point was just to bring everyone from the country together to share preventative measures and successful chronic disease programs. This allowed for more training for public health officials, and it established a coalition of voluntary, so less funding, and professional, more funding organizations. And then finally, in the 1987, the National Center for Health Statistics became a beneficial component to the CDC. So it allowed the CDC to keep all their information in one place, such as historical and population surveys. This also led to the establishment of the National Vital Statistics System, which is still used today. So it keeps every birth and death in the United States just in one place. The main concepts that were focused during these past 4 years were the prevention of disease and injury, as well as the promotion of good health incomes and behavior and avoiding bad outcomes and behavior.
One of the major events from my time frame was the Second International Conference on Health Promotion, which was held by the WHO organization in April of 1988. There was 42 countries with 220 participants. And pretty much what they set out to do here was build upon the momentum set forth by the Ottawa Charter in 1986. By doing so, they would focus on healthy public policy, which entailed creating an environment that enabled individuals to lead healthy lives. The major focuses here were government sectors being responsible for this health regulation. So they needed to maintain and record data as well as use this and provide guidelines and recommendations for members of the community. They also wanted them to have the same urgency as economic decisions such as agriculture and education in terms of health policy making. They wanted to decrease the gap between access to healthcare in terms of disadvantaged and advantaged members of the community. They also wanted to continue the support of women in healthcare, focus on food and nutrition by universal access to food. The government needs to use the purchasing power on the food market to maintain affordable prices. And lastly, they wanted to focus on the workplace and ensuring that there are safe procedures in regards to hazards to human health as well as our use of resources. Next came the Third International Conference on Health Promotion, which was a couple years later in June of 1991. There's an increase in members, so there's 81 countries present. Major concerns here moving forward was that millions were still living in deprived conditions and the dramatic increase in threat to global environment. So they had proposals for action which include accountability to achieve this. Developing nations were being exploited by developed nations, so they needed to extend a hand in their procedures and framework and aim towards sustainability. The key strategies that they used were to engage individuals in the community to action. This would increase advocacy through cooperation of government and community, giving them the tools they need to make their own health conscious decisions. And any conflicts that arose, they wanted to resolve them through societal interests and ensure that resources were not only equal but equitable to all. And here we just have an overall arcing promoting health and promoting sustainable development visual. This shows all the aspects that go into making policies and procedures, all the considerations that need to be had.
My time frame was between 1992 to 1995. In 1993, nearly 3,000 local health departments operated in over 3,000 counties to provide health services to citizens. These health departments represented city, county, and district health organizations. Of those nearly 3,000 health departments, 96% provided vaccination services, 86% provided tuberculosis treatments, 68% provided family planning, and 54% provided cancer prevention programming. And also in 1993, federal, state, and local health agencies spent around $14.4 billion on core public health functions. This made up about 1 to 2% of the $903 billion in total healthcare expenditure. And finally, in 1993, 16 university medical programs were launched sites for the 15-year, $625 million Women's Health Initiative, where approximately 3,000 women will be enrolled to each center to investigate the most common causes of death and disability in women. Also in that year, the National Center for Nursing Research became the 16th institution added in.
I had 1996 to 2005. So in 1997, the Jakarta Declaration on Leading Health Promotion into the 21st Century was held in Jakarta, Indonesia, which was the first conference held in a developing country. And it emphasized that poverty is the greatest threat to health, while peace, shelter, education, social justice, food, a stable economy are all requirements for health. And it established a call for action to raise awareness of changing determinants of health, to support collaborations dedicated to health promotion, to mobilize resources, accumulate best practice knowledge, and enable shared learning, to promote solidarity and action, and foster public transparency and public accountability. Their main goal was to call on national governments to sponsor networks and foster health promotion within their communities. In 2000, the Mexico Ministerial Statement for the Promotion of Health from Ideas to Action was held in Mexico City, and leaders met to establish a new call of action that emphasized promoting health using local and national governments. Their main goal was to strengthen health promotion policies and ensure that those policies were being enforced by using those local and national governments. And in 2005, the Bangkok Charter for Health Promotion added on to the Ottawa Charter by focusing on the importance of commitment to public health policy by governments, international organizations, and the private sector. Their main goal was to make sure that health and well-being is available to everybody equally by partnering with these organizations, the private sector, and governments to regulate these health policies, initiate new policies, and monitor the progress of the policies that have already been established and the new ones. And these are our references.